Welcome, everyone, and thank you so much for joining us today. I am thrilled to have you here for our CNO Corner conversation. We all know that nursing teams are being asked to do much more with less, and one of the biggest culprits stealing time from patient care is documentation. Today, we're going to talk about what it looks like when we actually solve that problem in dialysis. We'll be hearing real world insights from Kasey Matthews at Reid Health on how EMR integration is transforming dialysis operations from the bedside all the way to billing. It's going to be really practical, honest conversation, and I know you're going to walk away with something that you can bring back to your team. So there is a Q&A function at the bottom of your screen. Feel free to pop in any questions that you have along the way, and we will try to get to them at the end. So I would love to hand things over to get us started. Brittany, please take it away.
Thank you. Good afternoon. My name is Brittany McGill, and I am the Chief Nursing Officer of Outset Medical. And I am so excited to have Kasey Matthews join us today to share her real life experiences so that we can hopefully assist you in applying these outcomes to your organization as well. So, Kasey, welcome. If you would like to introduce yourself and talk a little bit about your organization and your dialysis program.
Well, thank you for having me, and I would love to. My name is Kasey Matthews. I am the Dialysis Clinical Supervisor here at Reid Health, and our dialysis program is in its toddler phases, meaning we had contract before, and then we decided to take on the program ourselves, and so they chose me to headline and take hold of that program. So we encompass our dialysis unit, and we also have dialysis operations within the ICU itself.
Perfect. And how long have you guys had your in-source program with Tableau?
Our launch date, go live date was October 24th of 2023. So we're going on our third year here with a partnership with Tableau.
Awesome. Do you mind sharing a little bit about, the outcomes you guys have achieved or realized since you went live?
So this was my very first experience with Tableau. When my administration came to me and said, we're going to run our own program, we want you to be in charge of that program. They said, we have partnered with Outset, and they have the Tableau machines. And my first thought was, I've done dialysis for quite some time and I've never heard of them before. But I'm glad that they partnered with Tableau and Outset because it has been, a great learning experience for me dealing with the new machine and its program. However, since going live, like I said, I've been in dialysis for 11 years. And first and foremost, after having this experience, I wouldn't change or trade my partnership with the Outset and Tableau machine for anything. So that right in itself is a load. So kudos to you and your company and the machines. So since we've gone live, we've achieved operational efficiency by creating a hybrid dialysis and ICU role that allows us and our RNs to float between the two disciplines seamlessly and to be utilized in either of the departments where needed. We've also had zero CLABSI since we've gone live. So
congratulations. That's
for that one. Yes, it's a very big deal, and we follow those standards and platforms very closely. The administration, like I said previously, was that they made the right choice during their RFP process when they chose Outset and Tableau. And some of the main reasons I say that is because with the training and the education process, it was very thorough, it was very hands-on, and these machines are very user-friendly. And my team came to me without dialysis experience. So they were brand new to the dialysis world. And so I thought I had my work cut out for me, like teaching the dialysis principles and, the ins and outs of the dialysis treatments and machines. But with the training program, they flowed. I mean, it was like a second nature to them, how quickly they learned. And so made the process a lot more comfortable for me. I've worked with several different dialysis machines throughout my 11 plus years of dialysis, and by far have to say that this was the easiest machine to learn and to operate. It is compact, it's quiet, provides detailed visual and written step-by-step instructions, which I think is very important to support staff success and for patient safety. And quite often our patients actually compliment the consoles because of how quiet they are and how nice they look. And we are able to offer smaller treatment or shorter treatment times and still producing the same efficiency as the other machines. And I was actually skeptical on that. Like, how are we only producing, the same results with a shorter amount of times? But when you look at the labs and you look at, the after treatment results, it's spot on. So I am very thrilled and happy to have had this brought into my dialysis world.
Yeah, I mean, congratulations. Zero CLABSIs, that's huge. The operational efficiency, because of the model you just articulated, is one that is very patient-centric. So I applaud you for that. And,
Yes.
Having your team provide that feedback about ease of use also, I'm sure, creates joy and satisfaction in the roles
Absolutely.
of those nurses. And so I know that you had a very successful go live and your program has been successful, but you went a step further and continue to elevate your program through the use of EMR integration. And so I want to talk about that today because the title of our webinar is, less charting, more care. And so I know you've got a story to tell. So if you wouldn't mind sharing that with our listeners.
Absolutely. So, and I would assume that this story is a story of most users of the Tableau machines, but we integrated with our Epic platform, which is our documenting platform here at the hospital, to the Tableau. So the EMR is integrated, and so there's that directional talking, if you will. So it sends information from the machine directly into our Epic platform, documenting. And I mean, I guess you could call me a skeptic, but then again, so without ever having that prior usage of integration of sorts, it has been so beneficial to our program. It feeds our Epic platform real-time data. And with that, our process before the integration was that my staff would go to the machine, they would write down and they would document on paper all of the dialysis, excuse me for my lack of words, all the data that you would need to input into your flow sheet, whether, from blood pressure, heart rate, arterial, venous pressure, all the stuff that you need to document during the treatment and throughout the treatment. So you would document that on paper, then you would take that back to your computer, and then you would transcribe that into the Epic platform. And then, so when the EMR integration occurred, the machine was telling Epic, these are all your numbers, this is your data. And my nurses and even my techs, everybody overjoyed with the fact that it was saving so much time, and I didn't realize how much time it was saving until we started crunching numbers and come to find out. And I didn't believe this, and I checked my math like 3 or 4 times because it is saving us over 700 hours annually per year by not having to double document.
Yeah.
And, that's one of a nurse's biggest pet peeves is double documenting. And so that right there is just saving so much time that you have to, give to your patients, give back that time to your patients. And, so it's better for patient communication, it's better for patient safety that you're able to give that time to them. And so after doing that math and seeing that there's over 700 hours of double documenting that you're saving, I think we figured out that it was a third of an FTE of time being saved by not having to double document for that information to go from Tableau to my Epic system. And so that, that in itself was like $35,000 per year.
Yeah.
And so I know those numbers are it was just so big to me that I didn't believe it myself, but math is checked and it's real that time and money saved and all you can give back to your patients and back to your organization. So that is epic.
Yeah. Cute. It's so true. And when Kasey and I were talking about this webinar today, we were also thinking back that 35,000 in annual savings not only paid for the install fee, it more than covered it, but that is a year-over-year savings. Not just, financially, but you're also saving your nurses time, which you mentioned gives them the ability to have more direct patient care, decreases frustration amongst having to double document. And then you also made a really good point about how that automation reduces human error. Because anytime you're transcribing something, there is a greater opportunity to have that, which just increases inherent risk that you wouldn't otherwise have. I think you were sharing, some of the feedback that your nurses gave to you, and I think it would be awesome to share with our audience, some of their remarks about how happy they are post integration.
So not only was it saving them steps back and forth from the nurses, area to the machines every 30 minutes, and having to, transcribe that, but they are able to, at any given point, look at this real life data flowing into their flow sheet. And, they can see trends a lot easier because it's right in front of them.
Yeah.
So, they were above and beyond, thrilled that data was right there, right at their fingertips. And so they could see the patient's trends. They could see, if there was any kind of clotting issues or TMP issues going on. So just the other day I was having a conversation and mentioning that I was going to participate in this webinar. And one of my nurses, asked what it was about. And I told her, since having, the Tableau machine talk to our flow sheets, she goes, "Oh my gosh, I couldn't imagine doing it without, that integration and that data being transferred over." And she's like, "I don't ever want to go back the other way." I said, "Well, that is never our plan." And, as we progress, as an organization and with our partnership with Outset, we're only going to continue to grow that technological partnership, and we're going to keep advancing a lot right along with you guys. And so they definitely appreciate that integration, and they definitely don't want to go back the other direction.
Yeah. I love that you said partnership because, that is really what we believe in. Learn from each other and just continue to improve, for the sake of these very deserving patients. I want to compliment you because you have got a 100% nurse retention rate amongst your dialysis program,
Yes.
which is something that you should absolutely brag about. And, I know you said it was user friendly and they don't want to revert back to manual processes, but like hearing your story when you also articulate the patient safety features and, the ease of use and the small footprint, I think about how all of this packaged together would contribute to their retention efforts. And so anything you want to add to that? Because your nurses seem very happy.
I mean, they have a pretty good boss. I would have. I'm kidding.
Yes,
No,
agree with that too.
we function as a very well-oiled machine here. We strive for smooth, effortless days. And we work in healthcare, so that's not given to anybody for any day. However, when our main source of strife could be the technological side. Things crash all the time. But when this is just a seamless pair, the integration has been a seamless pair. And they are very happy, outside of, personalities and things like that, when your technology works the way it's supposed to. That just makes for a far better day than I could ever offer just from being myself. And so it reflects, when they're having a good day, it reflects onto the patients. They have a better day. They have a better treatment. Ultimately, nobody wants to have dialysis, but when the experience itself can be, your staff is competent, your patients feel and see that. And when your staff is happy and things are working well, your patients definitely notice, and it makes for a better experience for them.
Yeah, agreed. So when we started this webinar today, you mentioned operational efficiency. And yes, you gained that with integration, but will you also share like how your team is pulling patients up from the emergency department? And because you're in both the acute dialysis and the ICU, you've got a lot of flexibility there. Because I think that EMR piece is important to all the departments that you touch.
Treatments in the unit and in the ICU, having that data flow just makes for a more seamless treatment, and makes for anybody who is involved in that patient's care to have that data at their fingertips as well.
Mm-hmm. You had mentioned that when you've got admissions coming up from the emergency department, the team is able to get their treatment started, prior to their arrival. And it just seems like this integration has sped up your patient flow and your throughput. Would you?
Absolutely. Yeah. So in that regard, yeah. So we always keep an eye out, for the patient census, and for dialysis patients that may come through the ICE or the ED, excuse me. So when we see them, we contact our nephrologist and go, okay, we got so-and-so here. Let's get an order and let's get that programmed and that machine and their flow sheet connected. Because once we assign a device, that device is automatically talking to that patient's Epic flow sheet. So we have data from before the patient even reaches the unit, and we are ready, set, go. We get that patient from the ED. They don't even make it to the floor they're assigned to, because we'll get them first, because we're ready and set to go. So we get that information input. And like I said, that integration allows it to the machine to start transmitting that data right away, and definitely sets for a speedier process. And we get the patient getting healthier before they even make it to their unit floor.
Yeah, that's amazing. I'm sure the ED absolutely loves the dialysis department. And I think that's so cool that there are interdisciplinary, actions on both sides that just speed everything up, and you can tell they're working together, and that's special. Will you talk a little bit about, the implementation and integration process? What did that look like for you as you were, working with your IT teams to build this?
So my part in it was giving to our IT team, and they were working hand in hand with the Outset IT team for the integration. So I had to give them, okay, what data do I need that machine to send to our Epic flow sheet? So I gave them all of the data points that, okay, this machine provides this info. I want it here in Epic. I want those pieces communicated. So I gave them the foundation of what information I needed to have to make it be efficient, to make it worthwhile. And so I gave gave them, plenty of, flow sheet lines that they would have to integrate into there. And I don't know what they do on their end because it's magic to me. I don't know how it transfers from one device to, our Epic platform, but it does. And I am very happy for that. So whatever they had to plug in, I gave them the information I needed and would be beneficial for our team. And they made it happen. But so when you see the live stream data coming through to your Epic platform, and it's like I said, it's magic because I don't know how they do it, but end all be all, it saves time. It has made room for less human error, staff retention. I mean, I don't have anything negative about this integration to say. And I wouldn't, like I said before, I would never want to go back the other direction.
Yeah. Yeah. Well, I think the main thing we wanted, the audience to hear is we at Outset have done this so many times with so many EMRs that we can confidently partner and, shepherd your IT teams. And for the clinical teams, it's really a pretty low lift. You just need to say what you want where that works with your workflows. And then you're right, the IT experts make the magic happen.
They really do. They're magicians.
Yeah. So, as we wrap up here, any like parting words you want people to know about? This IT can be kind of a scary thing for clinicians, but you did it successfully. Anything else you would want them to know?
It's definitely a step in the right direction for where our world is headed. We are becoming more technologically advanced every single day. This is definitely a step in the right direction for everyone involved.
Yeah, agreed. I mean, as nurse leaders, we are charged with how can we positively impact the daily work of our nurses, by removing barriers and leveraging technology and creating as much efficiency as we can to give them their precious time back so that
Absolutely.
they can be at their patient's bedside and not in front, of a screen. And so, I mean, everything you articulated today is just that. EMR integration solves for those things. So thank you, and I applaud you. We so
Thank you.
appreciate you taking the time to educate and inform us, and you enjoy the rest of your day.
Thank you, and I appreciate you and your company's efforts and all that you do. Thank you so much.
Okay, take care.
Thanks.
All right, bye-bye.
Bye.